So, what is a disease? A disease is an abnormal condition that negatively affects the structure or function of part or all of an organism that is not due to any external injury. So, essentially, it just means that your body is not functioning normally. It is abnormal. It's not working how it is supposed to, and that is going to be due to something other than, accidentally smashing your thumb with a hammer. Accidentally smashing your thumb with a hammer isn't a disease, it's just an injury. So we divide diseases into different types depending on how they are acquired. So a communicable disease is a disease that is able to be spread from person to person. This is similar to a contagious disease, which is a disease that spreads easily from person to person. So these are the same general concept, it's just that communicable diseases can potentially move from person to person, whereas a contagious disease easily moves from person to person. So these are much more infectious than communicable. Then we have non communicable diseases. Non communicable diseases are diseases that don't actually spread from person to person. For example, you get tetanus from an injury, you don't get tetanus from someone with tetanus. And then we have non infectious diseases. These are diseases that aren't actually caused by an infectious agent. They're caused by your genetics or your lifestyle. Things like cystic fibrosis or diabetes would be example of non infectious diseases. So if it can be spread from person to person, it's communicable. If it easily spreads from person to person, it's contagious. If it doesn't spread from person to person but is caused by a infectious agent, a bacterium or fungus or virus, then it is non-communicable, and if it's not caused by an infectious agent, then it's non-infectious. So when we talk about diseases, diseases cause you to develop specific signs and symptoms. So signs are going to be objective, measurable indicators of disease. These are things that an outside party can see and measure about a person. This includes vital signs like heart rate and blood pressure and respiratory rate. These include things like whether or not you have a fever, if you have a rash, if you're vomiting. These are all things that we can measure. So those are your signs. Symptoms, however, are going to be subjective, unobservable indicators of disease. So these are things that the patient has to directly report to the doctor. As an outside observer, we can't see them. So these include things like pain, fatigue, nausea. So these are things that the patient experiences that can be really important to diagnosis, but as medical providers, we can't directly observe. Then we have the stages of the disease. So stages so disease follows five stages: incubation period, prodromal period, period of illness, period of decline, and convalescence. So the incubation period is the period between when you are first exposed to the infectious agent and when you start to develop symptoms. So between exposure and development of symptoms, we call that incubation period. Then we have the prodromal period, which is when you first start to show symptoms. But the symptoms and signs are usually vague and indistinct. This is what I like to call the "I'm sure it's just allergies" phase. You wake up with a scratchy throat and a little bit of a sniffle, and you're just feeling not great, but you don't want to admit that you're sick. So you just say, I'm sure it's just allergies. And then the next day you wake up and you're sick, sick. That's what we call the period of illness. So when you are developing severe and distinct signs and symptoms, that is the period of illness. Eventually, hopefully, your immune system starts to fight off the disease and you start to feel better. That's what we call the period of decline, when we have a decrease in the signs and symptoms, and then eventually the signs and symptoms go away completely, and we call that convalescence. We have returned from that abnormal state to our normal state. Now, when we look at this graph, The blue line is showing signs and symptoms, and the red line is showing amount of pathogens in your system. Note that even once the uh, signs and symptoms have gone away completely, that does not necessarily mean that the pathogens have left completely. Depending on the disease, your body may or may not completely clear all of the pathogens out of your system. If you're dealing with a herpes virus like herpes simplex or varicella zoster, which causes chickenpox, or EBV, which causes infectious mononucleosis, once any of those viruses are in your system, they are there for life. They're with you forever, even if you don't have any more signs and symptoms. So incubation, prodromal, period of illness, period of decline, and then convalescence.